Well, hello everyone. Tonight I've got a second commitment engagement that is really important, as you are all very important as well. So I am doing this as a recording, and we will get into tonight's videos, and we'll see how it goes, but it should go very well. And by the way, if you're only in for the first section, I'll still count you in, even though you haven't watched necessarily to the end. So if it's a shorter time period, uh, you're still in the ballot. But we have the ballot is for an ultimate. That's a $1,300 device. And that has the two wavelengths, the 660 nanometer, which you can see is going right through my hand, and the 810 nanometer, which you see is just a glow from the units. That unit will be drawn at the end of March, as to all those that have joined us on these webinars. So I want to remind you that as well, we have a YouTube channel. Go to SunPowerLED, at SunPowerLED, and you can go to our YouTube channel. We have some extra videos there as well. And please remember to subscribe and tell your friends to subscribe as well. So with all that being said, let's get on the roll. So can you tell me a little bit about the light therapy? First of all, when you first heard about it, did you believe that it would actually could make a difference?
No, no, because I didn't understand it, and I didn't see it until I had injured my shoulder, and then I came to see you and tried it, and immediately saw results.
So what did you use? Was it one of the Palm devices?
Not initially, because it was what, 2019, I think.
Oh, okay, that would have been one of our earlier devices then.
Right.
The Genesis Health Light then that we used, the big hair dryer one.
Yeah, bigger one.
Yeah, it looked like.
Yeah, because it was on my frozen shoulder, and I couldn't even lift my arm in front or sideways. And then I think it was about 20 minutes on it, and immediately I was able to get 45 degrees movement. Right. And then with more treatment, and it didn't take long, more treatment, I was able to raise my arm right up above my head. So, which I definitely need for when I play drums or bagpipes.
Right. Well, that was your first experience. Did you have anything else you used it on?
When I broke my hand 2 years ago in the summer, after I got the cast off, I kept using the light and was able to get quicker movement in my hand because I was unable to close my hand. And with regular treatment of the light, it didn't take long, and I was able to get a full fist.
And that's using the red. This is what we call it, photobiomodulation or red light therapy. It's pretty amazing what it can do.
Oh,
and
it is.
Now you can see and believe how light can make a difference.
Oh, absolutely. And I find too that it's very relaxing.
Mm-hmm.
I almost want to sleep when I got it on, whatever area, like the wrist or on my shoulder. I can remember just relaxing so much with it.
Well, I really appreciate you coming on, and not only that, you've also shared the light with a few other individuals as well.
With great results as well. A friend of mine in the band, she also had a frozen shoulder, and she couldn't believe how quickly it worked for her as well.
That's wonderful. Yeah. Well, we had one individual in particular that they had been doing work with physiotherapy for like 6 months, and they just had a little bit of range of motion. Mm-hmm. Within one treatment, they were able to see quite a change.
Oh, absolutely.
Yeah. So what's your story? How did you find out about the PBM light?
Well, I found out about it through a friend of mine. I play in a competitive pipe band. I play tenor drum, and playing tenor drum requires a lot of movement, the arms and shoulders, for visual effect and for what we do for playing. And my friend in the in the pipe band, knew that I had been struggling for about 18 months to 2 years with a frozen shoulder.
Right.
I don't even know if it's an injury. It's just something that happened without any kind of explanation. But I had frozen shoulder, and for upwards of 2 years, I was dealing with pain with certain movements and a significant amount of reduction in my range of motion, which made it difficult for me to play with the band and do other things in life. So my friend said she knew of this light, that I should give it a try, and she offered to let me borrow her light. So I did, because I had kind of plateaued. I had been seeking a number of alternative treatments like acupuncture, and I was also seeing a physiotherapist, and I had just completely plateaued in my healing. It'd been a number of months and there had been no more significant improvement, and I was really frustrated.
So your range of motion at that time was really shortened.
Yeah, I would say I was by that point, I was kind of plateaued at probably 70% of my functionality with my shoulder. Mm-hmm. And I was frustrated because it had been a long time, and there was still periods where I would have really sharp pains. And I wanted to do, activities that I enjoyed previously, and I couldn't because of the restrictions. So that's how I found out about the light. I had heard of red light therapy before, didn't know a whole lot about it, but was definitely interested in trying it because I had heard good things about what it can do for the body. So that's how I found out.
Okay. And so you started using the light. How often did you use the light? I
used the light, I believe, once a day. Mm-hmm. For probably 15 to 20 minutes, in that range of time, just once a day. Sometimes I might have done it twice a day, but definitely once a day. And within 2 weeks, right away, within a matter of a couple of days, I noticed a difference. And by 2 weeks of using it daily, I had no more pain, and I was at full range of motion again with my shoulder. And I have not used it since. I have not needed to use it since. I am right back to pre-frozen shoulder abilities.
Beautiful. And did that also affect your sleep then, with pain?
It did. There would be certain times where, I'd roll over certain movements while I was sleeping. I would get a jolt of pain in my shoulder. I couldn't sleep it was my left shoulder that was affected, so I couldn't sleep on my left side either. And that's not an issue anymore.
That's really neat. And you haven't needed to use it since, and you're still pain-free and everything.
Yeah. One of the things I really missed being able to do while I had the issue going on was I did a lot of yoga. I did yoga multiple times a week, and it made it really hard for me to do the majority of the poses that you need to do in yoga. Every now and then I would try to do just a standing only yoga, but still you have to extend your arms or put your arms above your head or just do certain things, and I couldn't do it. So I went almost 2 years without doing yoga, and I'm back to doing that now with absolutely no modifications and no restrictions. So
beautiful.
Nice.
And that was all due to
100%. 100%. Yeah. I mean, the therapies that I was doing helped to a certain extent, but I just plateaued, and no matter what we were doing, I couldn't get past that plateau, and the light did it for me. I wished I had known about the light sooner. I probably wouldn't have suffered for so long.
Well, I want to thank you, Jill, for coming on today.
No problem.
I have knee, I guess it runs in the family. I have knee problems with my right knee. And I take my dog for a walk every day, rain or shine. It's like 3 or 4 miles. And so my knees are super important to me, but this one always has cracked and popped. And then there was no real event, but man, it was just a big pain all at once in my knee over the night. And I just was, I'm a tough cookie, so I don't cry easily, but man, something was wrong. And so I went and got some help and at an urgent care, and then ended up having an MRI, but you know, those have to be scheduled out. In the meantime, I was using the light, of course, because I'm no dummy. And I was using the light every day, a couple times a day. And I don't know if it just took the inflammation down, and consequently I didn't have any more pain after that, or if maybe it healed a partial tear. That is what the MRI said, is that I had a partial tear of my meniscus. And I don't know if it's on its way to healing that. I don't know what your light does, Tom, but it's kind of like when you turn on the TV, you know it works, but you don't know how it works. That's kind of the same thing. It works, and it doesn't slow me down for the 3 or 4 mile hike that I take every day with my dog. So I'm super grateful for that. I also thought of something else, Mom. She has a lower partial, and she had a sore under her partial that was messing with her gums. You used it one time.
Yeah.
One time, just shining that light, and then it was gone.
Mm-hmm.
Right? Yeah. Isn't that the way it went?
It's been more than once too that I've used it.
Oh, yeah.
The first thing I really focused on with it when I got the light was I had a muscle that was deep inside my left calf that had been basically in spasm for 20 or 30 years. And I'd go to different doctors and they try this. I went to a massage therapist and she tried something and that didn't work. And so basically I was like, okay, well, I'll use the light on it. And because it's for inflammation and stuff. So that was the first thing that I was doing a bunch of stuff, but that was the first thing that I had like 100% results on, maybe 99%. Let me see. Yeah. Okay. So it's still a little sore to the touch because I need to treat it up by my knee, but I haven't even been treating it lately because it's been so good. I also had to stop skating because my knees hurt too much when I skated. I'd wore out the meniscus in my knees. So my knees would be a little iffy sometimes. They're not bad. I haven't had them replaced and stuff, but I figured, well, I'll work on my knees and see if I can get rid of those trick knees that pop up every once in a while. And pretty much I now have gotten rid of them. Then the other thing that I had, this wasn't from skating, was like tennis elbow. So,
Okay.
So working with a chiropractor, he taught me about ART, something reflexive therapy or something, where you capture the tendon and you stretch it like this and stuff, and all that would help it and things. But I thought, well, since this has been going on since 2006. I'd work with it on the light with it, and so it would make these 3 fingers fall asleep, get tingly and stuff, and
The neuropathy, yeah.
yeah. So, and then I've also maybe been getting a little bit of arthritis here in my hand. So I'm working on my hand, working on this, working on this, working on the lymph node here and the lymph node here.
Yeah.
It hasn't cured it, but it has lessened it a whole lot. So that's been really good. And since I'm 69 years old now, I also do it on my brain just because, I don't want to get dementia.
Hey, there's preventative maintenance there, right there.
Right. And I also, I partially, all right. Yeah. What do they call it? The sciatic nerve, I had the disc pop out a little bit. So I had surgery on that years and years ago, and that worked great for 2 weeks. And then I got a spasm in my back, and it sort of threw out my back, and I sort of had lower back pain ever since then. So I figured that's inflammation. So I work on that. So too, and that's helped some. That one, I think it's deeper and all that. So I'm hopeful. So I still use it.
Well, if we're going to, for myself, we actually went to get it for my husband, who has neuropathy, and he had a surgery done on his knee. And so we went and we got it, and we asked lots of questions and that. And so then we decided to buy it, and we brought it home. He had a lot of scar tissue on his knee from the surgery that had taken place, and he also has the neuropathy. So we were told that it would help both. And it has really helped his knee, that he feels such a difference in his knee that he's walking much better now. And also on the neuropathy, his feet were always cold. And when I touched them the other day, they were very warm. So it's starting. Yeah, it's so neat. And it's starting the circulation, I believe, in his feet, right? Mm-hmm. So he has always been worried about falling because of the neuropathy. And just this week, we have decided to go for walks. And we're starting off gradually. And yeah, so I am really thrilled with the product and what it did for him. So when I was thinking about what it did for him, I have had a Baker's cyst. And if anybody knows anything about Baker's cysts, they are extremely painful.
Where's that located?
It's on the back of your knee. On the back of your knee.
For some that don't know, go ahead.
Yeah, and it's like a little bulge that comes out. Mine burst, and so very painful. And so I went to an osteopath who really helped me. But when we got this device, I said to my husband, "Do you think this will help my knee?" And so we phoned to find out how long do I keep it on my knee, and because of the two lights, right? So the first light, I kept it on for 3 minutes, and the second light, I kept it for 7. And I do it for 5 different areas on my knee. So I would start
to help out people, the one light is the red that you're talking about, and depending on which model, whether it was the Ultimate or the Super Palm, the Ultimate is the 810, and the Super Palm is the 1050 nanometer. I can't remember which one is yours slightly visible.
It's a Super Palm.
Your Super Palm, so it's totally invisible. You just see that one little red light in the corner that shows you that it's working. Otherwise, you wouldn't be able to see that at all, know that it's running, other than you could feel the energy coming from it. So go ahead. Yeah. So you used it. So they 3 minutes of the red and 7 minutes of the near infrared around on a particular
5 different parts of my knee.
Yeah.
Yeah. And I would say within maybe, because I did it every day, 2 times a day, and then I went down to 1 time a day because it was better. And now I only do it if I get a little bit of pain, which I don't get too often. It's like I have my knee back, and I'm just thrilled to death to have my knee back. And so the other day, my other leg was giving me a hard time, my knee and my other leg. And I think it's because when I had the Baker's cyst, I would shift my weight when I walk to the other knee. And so when I got the other one back, then it kind of off-kiltered me again. And so my other leg hurt me, and I just used that light on my leg that night, and the next morning I did not have that pain. So I really like this little device that we have.
Can it help with nerve damage? And there's a recent study that says how it can help with Bell's palsy and how fast it can help the nerve regenerate and grow back. And so it's very possible that it's not just for Bell's palsy, but other nerves as well. And there's a rat study that was done on spinal nerve damage and how they were able to see that it could help on that as well. So there's research out there. One needs to do their research first, and there's lots of research at our site. pain post-surgery. It depends where there's a question here from Susan. Thank you, Susan, for your question, is the helmet good for pain post-surgery? And I guess it depends where that pain is, but it doesn't matter where you have in the body. It's pretty neat. If you can do light treatment before the surgery, that'll even help as well, but even after. So I do have the follow-up question. On the left hand, this is a fellow that had major heart surgery. So on the left is the beginning of the surgery. And if you can look at the right-hand side, this is within 1 month that he has had this kind of healing taking place, where the nice thing is how nice and uniform, how it's able to help the incision heal without scar tissue. So this is, significantly reduced or no scar tissue as it's healing through that area. So this is a good example. Now, if we go to the next slide, please. Unfortunately, the lighting was a little different, but I'm hoping that you can see in the monitor, it's just the way the angle was taken. So the forearm is in the bottom of the picture, and the fellow's leg is the same fellow. His leg is on the right-hand side. Oh, sorry, right, up. If you look closely at the incision, if you can see it on your monitor, on his arm, it's really nice and smooth. There's almost pretty much no redness there anywhere along the cut line. And on his leg, though, you can see it's still puckering. It's not nice and smooth. There's still some red areas. Well, the difference between his arm and his leg was the fact that on his arm, he treated it every day, at least 3 times a day. And his leg, he decided, well, it's kind of awkward, and everything. He likes to wear long pants and this and that. But anyways, so he only treated once a week. So you can see the leg and the upper part once a week, and his arm treatment daily, and you can see the difference in progress right there. I wouldn't recommend doing a comparison study like this. If you're trying to heal as much as you can, as quickly as you can, so your outcome is the best it can. And one other thing that is also being done now is more of pre-treatment. So if you're talking of upcoming surgery, to pre-treat the area a day before or a week before. In my brother's case, he was extremely strong, and he lifts heavy. He's a mechanic, and he lifts the great big truck wheels and that kind of thing, and so very strong. Well, he needed knee replacement. I'm not sure if he would have started a long time earlier when I first told him that he would have needed the knee replacement, but he didn't think light could do much. That was just, sometimes it's hard in your own family. Well, when I told him that if, because of his strength, that they may have to cut his muscles before they could put the knee joint in, he was not too happy about hearing that. And I said, look, if you treat that whole area with light, there's a good possibility with our light, PBM light, it's possible then you're going to loosen the muscles in that whole area and make them very pliable. And the surgeon had said that this was possible for him because of his strength. Surgeon said that it was an absolutely excellent surgery, that he did not have to cut any muscle tissue to give extra extension so that the knee joint could be replaced. So after that, my brother was able to heal very, very quickly. She wanted to ask Dr. Duke about using the PBM for an infection. And so As a matter of fact, Beth, if you want to call me after the program is over here, the webinar, I can get into that a little deeper with you, because I've seen there's one of the women, she had severe infection in through her jaw that she had been on antibiotics for a long period of time, and the jaw continued to be dissolved. She had a large section of her jaw that was significantly impacted by this infection. And anyways, she has been able to totally clean that up. One of the fellows from my church, he's a senior, he'd be close to 90, and for a major part of his life, something like 60 years, he's had infection one after another in the ear area, and they've cut out sections of bone around his ear, and he had this infection going on for a very long time, 60 years, and he started using the light, and within 2 weeks that area drained and healed of the infection, and he had no more pain after all that time. Hi, Terry. Hi, Vera. How you doing?
Good.
Great.
Okay, very good, very good. Thank you so much for joining us on this interview. And so tell me, how has Terry been doing as far as before you got to know us? What was happening? How long has he had Parkinson's?
Oh, you had Parkinson's probably 8 or 9 years.
Okay.
And we were introduced to red light therapy through Gateway Physiotherapy, and Terry had some limited improvements with it over the last couple of years. A little, his arm swing when he walked improved a little increase in taste and smell, but limited.
Okay.
So when his physiotherapist suggested we try your helmet, which is much more powerful, we said, of course we would. So we've had tremendous results from it.
Yeah, that is neat. So when did you start with treatments for Terry?
That was mid-December, Terry?
Early December.
Yeah, about mid.
Uh-huh. And what was one of the first, so you put the helmet on, you did 1 minute of the red and then 3 minutes of the near infrared. That's our kind of standard protocol. And did he notice anything in the first or second treatment? What?
One of the things that I noticed immediately was sense of taste. And for somebody who's had no taste for 4 or 5 years, I was eating second helpings at the table. And I realized that it was the taste that was missing, but I also ran into an increase in smell.
Okay. So is your wife a good cook? Maybe I shouldn't ask that. There could be trouble.
Yeah.
Well,
she's a good cook.
He's put on about 5 pounds since he started the helmet because he's eating more now, which is good, because with Parkinson's, because you can lose your sense of taste, a lot of people lose weight. So that was a big improvement. And what was the other?
The increase in smell.
Yeah.
Again, I couldn't smell anything. Our office is in the middle of a farmer's field out in Concession 5. And going by fields that were just
freshly manured,
you
could not.
I couldn't smell them.
No.
Wow.
With this increase in smell, the guy was walking in front of us one day, and I said, "That guy's smoking a cigarette."
and I could smell it. And this is normal, not good. I could not smell anything like that.
Yeah, that really surprised me when he could smell that.
Wow, and that's really neat. And one of the things that, if I remember correctly, you had trouble falling as well. Is that something to that effect?
You're not. No, you don't. You're okay with a couple falls, but not so much.
Okay, all right. I might be blending this with somebody else I know that had real difficulty with falling, but that's one of the things that can also happen.
Yes, it is. I think Peter had some trouble, and I know it helped him. But Terry has been, I think, with going to he does a lot of exercise for Parkinson's, and I think that's really helped him.
So tell me a little bit about the exercise routines. How did you find that that's I know the exercise is one very key thing to do for Parkinson's, but what in the case of Terry, how did this help Terry, do you think, with exercises?
Well, we go to a Parkinson's physiotherapist who has a gym there in it's wonderful Gateway. And she does exercises and movements specifically for Parkinson's. Mm-hmm. And she was the one that helped it. She's very open to trying new things. And she was the one that mentioned about the light therapy. So okay. I think we found our best hope for keeping the Parkinson's at bay as long as we can through exercise and through the red light therapy. It's mm-hmm. a great combination.
Okay. And now exercise went better because of the light, or just?
Actually, yes. I remember one day Terry was doing in for a session of exercise, and Orla had mentioned that he seemed to be taking command or instruction better.
Mm-hmm. Okay.
So that was the positive.
So she'd say, raise your right arm, and Terry would be able to respond better? Is that kind of the idea?
Yeah. Yes. That's basically it, yes.
Okay. And you've noticed a little difference, too, in expressions. You mentioned something the other day.
Yes. That was I think that was after the second session. That now he has a spontaneous smile, which he hasn't had in years. His face was always the Parkinson's mask, and now he has much more expression. And my family have noticed a huge difference in him with the expression and with engaging in conversation.
Right.
Because he was getting to the point where he would be sitting when we had company and very quiet, and sometimes falling asleep and disengaged. And he would tell me that it would be hard to jump into a conversation when people are talking. But now he is doing that. We had about 30 people over Christmas Eve, and all relatives, and he was talking all night. And it was just great to see, and people were commenting on how much more engaged and how he was like he was, 3 or 4 years ago. Mm-hmm. So it has really, really helped.
Well, I go ahead.
I was just going to mention, Terry, too. You, I think, wanted to talk about the stiffness that you get with Parkinson's.
Yeah, we're going out for walks every day. The stiffness of the back of the neck, the back of the lower back, mm-hmm. and the knee joints, and basically anything that affects walking. I used to get these aches and pains quite a bit from all my joints. But now, virtually, I go out with no pain whatsoever. And halfway through, I might get the odd pain or so, but next to nothing compared to what I used to get. And when you're walking and you have a sore back or a sore neck or sore behind the knees, tough to walk.
Right, but now that seems to be helping that as well, so that you don't have as much of that. Or
I
do you?
have very, very little.
Okay.
And usually it's only one spot instead of two if I get it. Basically, the energy.
No, you're going to talk about energy too? Your energy being increased?
Energy increased. And it all accompanied each other. The stiffness of the joints and the energy of constant walking for 2 miles. It had a major effect on that. I get very little pain now when I walk.
That's beautiful.
And when you would come in after a walk, before the helmet, what would you do?
Yeah, before the helmet, I'd flop on the bed and be gone for an hour or so. But now I don't need to come in and lay down or anything. Basically, I just finish the walk and go on with what I'm doing.
Mm-hmm. So you've increased your energy through the use of the light helmet somehow.
Right. Yes.
Yeah, oh, that's beautiful. One thing I shared with you once before was this joke, and I think it's good. I'll share with it for our listening audience. I'll share this joke with you, and I think it's okay as a clean joke. But these two senior couples go out to eat, and the guys are like in the front seat, and the women are in the back. And the driver says, "Hey, Steve, what's the name of the restaurant we're going to?" Steve says, "I don't remember." He says, "Well, I gotta know, what's the name of the restaurant?" "I don't remember either." He says, "I can't help you." And he says, "What's the name of that flower with the pokey things on it? And it's usually red." You mean like a rose?" "Yeah. Hey, Rose, what's the name of the restaurant we're going to?"
You can identify it sometimes. Right?
So he needed that help with that Rose to remember what his wife's name was. So that's it's a clean joke and it's kind of funny, but yeah, that does happen sometimes. Anyways, I so much appreciate you guys coming on, and all the best in your journey. And I'm so glad that we could be a part of helping you guys with this.
Well, thank you so much. We so appreciate it. And one last thing that I didn't mention is that I find Terry walking a little more upright, because he does tend to stoop, and that was the major issue. It's why we started going to exercise in the first place. But I've noticed since the helmet that he is walking a little straighter.
Oh, that's beautiful. Well,
and that's just one other thing.
Excellent. Thank you very much. I really appreciate you joining us. And I'm sure this is going to be an encouragement to so many people out there that have gone through this.
Absolutely. It sure helped us.
All right. All the best. Bye for now. Okay. Bye.
Tom.
Hi, Rose.
Hi.
Tyson?
Hello.
So, Tyson, what happened?
Well, I went to like a cadet group, so it's like kind of like you learn skills and stuff, and I fell and hit my head. I got a really bad concussion, so I couldn't really do anything. I couldn't read. If I stood up for too long, I'd get a really bad headache. And we were trying different things like oils and stuff like that. And then my mom's friend recommended this, the red light therapy.
Yeah.
And so we went over here and we tried it, and straight away I felt results after it was done. My headache cleared up like quite a bit. And that day I was able to pick up a book and read, when before I couldn't even read a sentence. I'd get a really bad
And when
headache.
did this happen?
Happened, I think, last week, Friday.
Okay, last week.
It was Thursday that the
Thursday,
concussion,
last
so it was a
week,
week
Thursday.
ago.
Yep.
A week
So
ago Thursday.
Yeah,
And
he had like severe memory loss. He still doesn't remember that day at all.
right?
So I don't know if he'll gain that memory back. But we took him to Mac, and they did a CT scan and that, because he was continuously asking the same questions, like, what happened, why does my head hurt, and like it was on a reel, like probably every couple of minutes we tell him what happened. He's like, oh, that would be why my head hurts. I don't remember going to cadets. Yeah. And then he would ask it all over again, like, how come my head hurts? So like he probably did it hundreds of times. So they did a CT scan and they didn't see anything on the
That's
CT
at McMaster University.
Yeah, at McMaster.
Yeah, yeah.
And then he's got to follow up with a neurologist in a few weeks because it was that bad.
Right. Did you have any double vision?
No, not that I remember of that day.
But you couldn't read a book and you couldn't watch a video? Or...
No, he had to be in a dark room.
I had to really lie down. If I stood up and tried to move around, I'd get a bad headache. I tried reading a book. I got, I think, a sentence, and then I got a split and a headache again, so.
Okay.
Because he really likes reading, so he was hoping to, because he was bored. He gets bored because he was lying around in a dark room listening to audiobooks. But yeah, the minute he started reading it, just
okay. And so you did a light treatment under the helmet.
Yeah.
And that was 1 minute of the bright red and 3 minutes
of like the one you can't see.
Right, that's the near infrared.
Yeah. Yeah. And it was amazing. Like after the 4 minutes, I could tell straight away my headache was gone. I just overall felt better.
Yeah. So you were still tired and stuff. You
Yeah.
didn't read yesterday yet, did you?
No, I didn't read yesterday.
Oh, you didn't read on the day you got the red light
Yeah.
therapy. Yesterday you started reading.
Yeah, I tried it and I'm like, hey, I can easily read. I don't get a headache at all.
Well, we could tell a difference because he was really subdued. Like he's been really, like just hanging out in his room, really quiet and not.
Right.
And now he's like, whoop! So I'm like.
Oh, that is excellent.
He's definitely back in that sense.
And we're going to do just one more final treatment here, probably.
Another one, yeah, because
and just to make sure that things are covered. But well, thank you very much for being on our video, Tyson. And really neat how we were able to see this. This is going to tell a lot of people what light therapy can do.
Oh, he's very grateful. Yeah, we were very, very blessed and pleased that we found this.
Yeah.
Yeah.
Okay. All the best. Bye for now.
Thank you.
Okay, I hope you've enjoyed that. I just wanted to share with you that since I have another very important commitment, I cannot be here live. So this is a recording that we had to do earlier. But I just want to show you one thing. People have said, hey, can the light penetrate a human skull? As it turns out, this is Alfred, and Alfred is a fellow that thankfully donated his body to science. And so this is a real human skull. And I just want to show you here how the light can go right through the skull. As you can see, I'm moving it around with the palm light inside, or we can do it the other way around. We can shine the light through this way. So anybody wondering whether light can go through the skull, no problem. As a matter of fact, when we switch it over to near infrared, although I can't show you that, when we switch it through the near infrared, there's far more energy that's getting through into the brain. So I want to thank everybody for joining us tonight. I know it's shorter, but because of this commitment, I can't get into answering questions. So listen, have a great week and hope to see you next Tuesday. All the best. Bye for now.